Hello. So today it's March 22. My second COVID update. So I will show you our patient today. Ta-da! We have 2 appointments, but patient will call back. And the whole day we don't have patient. So we'll see. Just wait for the emergency cases. My doctor started here. Our reception got sick. They ran for the doctor. I hope she's okay. So right now I am in the reception because nobody's here, just in case. I will stay here until there is another receptionist will arrive. Here in the reception, you can see all the doctor's schedule. No answer this one. This lunch break. There is no answer also here. In ortho, one is confirmed, only one rescheduled, another one. So they're getting scared, I guess. That's good. Finally, they went to the doctor and it's only anxiety. So thanks God. I thought we were going to shut down and quarantine. So it's only anxiety. So lunch break muna si Inday. Yan. Vitamin C. Tilapia. So guys, I'm going to update you about here in Qatar. They announced how much the maximum price selling for face mask in Qatar. Yesterday I just bought like this N95 and it was 20 real each. But here, see, face mask N95 is only 10 real, so double the price I got from the pharmacy. So here's the list of the mask. So expensive. See, you can see March 22. So this is the worldometer update for coronavirus cases. For today, it's already 308,615. This already increased to 13,000. Yesterday, it was only about 11,000. 13,071. Recovered 91,834. Still going up. Total cases still going up. So here's the report for by country. China, they have +6 new deaths. USA +46 new deaths. That is today. South Korea 2, Norway, then Malaysia they have 1, Thailand, so far other country they're still okay. Philippines we have 6 OM. Mexico, Colombia, so this is the update for today, March 22. And because I'm working here in dental clinic, so I will show you also the Ministry of Qatar. Their orders here. Internal memo of Qatar. So all private healthcare facilities in Qatar subject operation for private healthcare sectors. So we are included. So number 1 is dental clinics. So we belong here. Dental clinics are to be open for emergency and critical procedures only. So they just receive it right now. All other clinics reduce physical attendance. They should reduce their people. All private healthcare sector, including hospital, to be stood ready and prepared to assist public hospitals required by Minister of Health. And Acting Director Nora Abdullah Muhammad Al-Mola. So I will show you what are the cases needed to be treated in dental. And this one, procedure type, essential, non-essential. So non-essential, it means it's not emergency. In restorative, we only have the moderate decay and severe decay. That's the only one you're going to treat, and also if the patient is in pain. And in the crowns, it's the completion of the crown, so they can come, or proactive replacement is not necessary to come right now. In cosmetics, active infection only, active in cosmetic procedure, no, they cannot come. In endodontics, root canal treatment, if the patient have active infection, patient in pain and swelling or cellulitis. So in emergency, any patient who is contracting the practice with urgent needs should be seen to decrease overflow to emergency departments. In hygiene, like cleaning, new patient, follow-up care, so they are not allowed to come yet. Can be postponed. It's not emergency. In oral surgery, only those active infection, patient in pain, and swelling of the cellulitis, swelling of the gums. Orthodontics, reband, deband, recall, they cannot come right now. Only the patient with complication, wire or bracket fractures. That's the only patient we can accommodate. And in periodontics, patient has no additional risk factors, diabetes, cardiac disease. And prosthodontics, bridge can be postponed, dentures and removables we can accommodate. That's all. The essential versus non-essential dental procedures right now during COVID-19. Okay, I will update you the Middle East because we are here in Qatar. So in Dubai, Roller asked local banks to offer companies relief, including refinancing and repayment referrals. And Jordanian security forces arrested 392 people for violating curfew and started Saturday morning. So be careful, mga kababayan. In Kuwait, imposed a partial curfew from 5 p.m. to 4 a.m. and extended school closure for 4 more months. Those who violate the curfew will be jailed for 3 years and fined. Ingat lang po. And in Egypt, shut mosques and churches. Mosque will only be used to notify prayer times, and churches have suspended the services. So the cases by country, in Iran, they have 20,610, including 1,556 deaths. In Turkey, they have 947, including 21 deaths. Israel, 945 cases, including 1 death. In Qatar, we have here 481 cases, no casualty. In Saudi Arabia, 392, 0 casualty. And Bahrain, 310 cases, including 1 death. In Egypt, 294, including 10 deaths. Iraq, 214, including 17 deaths. Lebanon, 206 cases, including 4 deaths. In Kuwait, 176, no casualty. In UAE, 153, including 2 deaths. Jordan, 99, 0 deaths. Morocco, 86, including 2 deaths. Algeria, 82, including 8 deaths. Tunisia, 60, including 1 death. Oman, 55. Palestinian, 44, no deaths. Sudan, 1 death. So that's my update for Middle East. Thanks for watching.